Hi everybody, my name is Lulu Achua. Today I'm going to be doing my assessment for respiratory. That's the respiratory assessment. I do not have an actual patient with me. I'm going to be using this teddy bear, a stuffed animal, as my patient, but please bear with me. Um, it's not going to be like a real person, but I'm going to demonstrate what I'm supposed to do on a real person. And checking the pulse, I'll just demonstrate like where to get it, though the hand is not full as a human arm. Before I begin, I go into my patient's room, knock at the door, go into the patient's room. I greet my patient, introduce myself. Hi, Mr. Jones. My name is Lulu, and I'm going to be your nurse for today. Today, I am going to be assessing your respiratory system. Going to be doing some assessment on your respiratory system. Is that okay with you? He says okay. All right. And before I start, I check my orders. I provide privacy to my patient. I wash my hands. I do the two-step verification check with my patient to make sure I'm working on the right patient. Mr. Jones, can you please tell me your first and last name? So while they're doing that, I confirm, cross-check with the armband. And your date of birth, please. Okay, so I have the right patient with me. I also make sure I gather my equipment, which is like what I need to do for this. I need a stethoscope and a watch, wristwatch for the respiratory and O2 timing. And I have to ask my patient some certain questions, like to gather the history taken from the patient. So I'll ask about any history of smoking, Mr. Jones. Any history of smoking in the past, or do you currently smoke? Okay. Any history of lung infection or lung disease? Any COPD? Any concerns about your breathing? Any concerns about environmental exposures? Any history of asthma? So none of that exists. Okay. Do you have any history of exposure? Any shortness of breath? Any coughing? Any like, do you think you have been exposed to anything that can cause you issues with your respiration? No. Okay. Any concerns with sputum? Oh, okay. You say you do cough occasionally. How often? When did the cough start? And how often do you cough? What makes it worse? Oh, I'm so sorry to hear that. And what makes it better? Okay. Now I'm going to be observing and monitor my patient's respiratory rate and pulse us. And I'm going to do the respiratory rate without the patient knowing, so that they won't give me some false readings. Now I check your pulse. So if everything is okay, since everything is okay with the pulse, I check for 30 seconds and I multiply it by 2. And for the respiratory rate, I check the rising and falling of the chest, or by watching through how the patient breathes, and watch the rise and fall of the chest. One rise and one fall is one count. So at this point, I'm going to be inspecting my patient's skin. And while I'm checking the skin, there are things that I'm looking for. I look for the color, and I check the cyanosis, or I check for pallor, and I check for any abnormalities, and then I make sure I document all my findings. So I'm checking my patient's color. The patient, the color is normal for ethnicity. No skin discoloration, no pigmentations. Check the pallor, it's pink. Patient is okay. Skin color is normal, no abnormalities found. Next, I'm going to be assessing the patient's chest. And on the chest, I'm assessing for I assess the chest wall for symmetry, and I also assess for any abnormal configuration. So I assess my patient's chest for symmetry and any abnormal configuration. So my patient's chest is normal, everything is normal. The next step I have to do is I have to assess my patients for I have to assess my patient's breathing, and in this I'm observing for how he uses his accessory muscles, or and then I'm also watching for any signs of distress. So I see how my patients, whether there's any labored breathing or any signs of difficulty in breathing. So I do not find any with my patient right now. Breathing is okay. I'm going to be examining my patient's anterior chest. In this anterior chest, I am going to check for any difficulty or differences in the symmetry. So I'm going to place my hand at the lower rib cage, and with my thumbs facing up. Let me place the patient like this so you can see, like so, with my thumbs pointing upwards, like so, like so. Sorry, it's not a real person. My hands were supposed to be like this. Okay, like so, to assess for any differences in the symmetry. In the process of assessing the rib cage, the anterior chest, I once I place my hand on the lower cage, I ask the patient to breathe deeply so that I have to watch the movement. So that has to be done with the patient, me telling the patient to breathe deeply. The next step I have to do is to auscultate the lung field. And in auscultating the lung field, I need my stethoscope. And to get a better result, I make sure I use the stethoscope in the right way, with the ears, if I may call this one the ears, the tip pointing inward. If you use it this way with them pointing outward, it's wrong. It's not going to give you the right result. So with the tip pointing at each opposite ears, if I can say that. So like so, then you can get the sound. And in auscultating, you use the back of the diaphragm. So you can use this part, yes. So I'm going to start auscultating my patient using the diaphragm. So I'm going to go on the anterior chest. On the anterior chest, I auscultate, asking my patient to breathe deeply. Mr. Jones, can you please breathe deeply? I hope you're seeing, please. Deeply. And while I am doing all of this, I'm trying to also identify the breath sounds. So there was no adventitious breath sound heard. The the breath sounds were normal. Now I'm going to be assessing my patient's posterior chest, and in the posterior chest, I will be checking for the symmetrical expansion. And by doing so, I have to place my hand at the back of place my warm hands at the I have to place my warm hands at the lower rib cage, with my thumbs pointing towards the spine, like so, towards the spine of the patient, like so. And While I'm doing that, I am asking the patient to take a deep breath, and also check for the symmetry and if there's any difference in the symmetry. Now, while still on the posterior chest, I am going to auscultate the lung fields and the posterior chest, using my stethoscope and the diaphragm of my stethoscope, and placing it on the I place the diaphragm of my stethoscope on the posterior chest 8, like so. So 6 is here, 7, 8, and I ask the patient to breathe deeply while I move the stethoscope to the other spots. While I'm doing so, I'm checking for any wheezing sound, any abnormal breathing sounds, like wheezing, rhonchi, the function of the ribs, and any adventitious sounds. But so far, the breathing is normal, no adventitious sound heard. Now is the I've come to the end of my respiratory assessment, and I have to conclude by documenting all my findings. If there is any abnormal findings, we put it down, and so far there is no abnormalities found or heard in my patients. The lung fields are clear, no adventitious sound. The skin color is normal for ethnicity, and if I had gloves on, I will don my gloves. I wash my hands, and I open the curtain, and I tell my patient I'll be leaving. Mr. Jones, I'll be leaving. Your assessment is complete, and I will get back to you later. Okay? Thank you.